Hello, I'm Mark Pegram. I'm a medical oncologist at the Stanford University School of Medicine and the Stanford Cancer Institute. I'm the Associate Director for Clinical Research there and a member of the Breast Oncology Program. A common question in the clinic is whether daughters of breast cancer survivors should have genetic testing. And this is an opportunity to review the current list of recommended risk factors where genetic testing of DNA from normal cells can be sequenced to determine whether or not there may be an inherited form of breast cancer predisposition, as well as other cancers in some family clusters. So these factors that bear on the decision to have genetic testing or not include a relative who's tested positive for an inherited mutation associated with cancer. For example, BRCA gene mutations would be a good example of that. Diagnosed at a young age of 45 or younger with any type or stage of breast cancer, including ductal carcinoma in situ, which is a precancerous lesion, regardless of family history. If you are diagnosed at a young age, then consider genetic testing. Diagnosis at age 50 or younger in either a small family or limited information about the family history, adoption, for example. So if you're really not sure about your family pedigree because of historical limitations, then it should also be a consideration. You should seek consultation from a genetic counselor. Cancer in both breasts or a second breast cancer in the same breast is a risk factor that would trigger an evaluation of DNA sequence analysis to see whether you have a genetic predisposition to breast cancer. Triple negative breast cancer diagnosed before age 60 is also a risk factor where DNA sequence analysis of the normal DNA from normal cells is recommended. Women of Ashkenazi Jewish heritage, meaning that their ancestors hailed from Poland, Russia, Hungary, and other Central or Eastern European countries, are at significantly higher risk for breast and ovarian cancers than other women. They have a lifetime risk of about 1 in 40 of having a BRCA mutation, which are responsible for about 5 to 10 of breast cancer cases and 15% of ovarian cancer cases. One or more relatives with breast, ovarian, prostate, pancreatic, or melanoma skin cancer, if you fit into that category, then also consider genetic consultation. And finally, patients with metastatic breast cancer may be candidates for treatment with new drugs like PARP inhibitors that work on patients with BRCA mutations or PALB2 gene mutations. And these drugs are now being tested in newly diagnosed breast cancers in earlier stages of the disease, for example, adjuvant therapy given postoperatively. And when that data becomes available in newly diagnosed primary breast cancer patients, the recommendation for DNA testing may expand to that patient population as well.